So today we want to talk just a little bit about Brazilian buttock lifts, or more appropriately termed fat transfer to the buttocks. Fat transfer is something that's used in a variety of aspects in plastic surgery, to use liposuction to take fat from one area that's not wanted and put it in an area that we do want. So we use it in the face, cheeks, lips, breast, but very popular in the buttocks. And that can help change the shape and the volume of the buttocks. The liposuction also helps really contour the area surrounding the buttocks, so the lower back and the thighs. That can put a nice framework around the buttock shape that we're trying to create. One of the things you may hear a lot about is there a particular risk with this procedure. And the risk that you might see or hear about if you're looking at the internet or hearing or reading about this is something called fat embolism. So injecting fat into the blood vessels or the circulatory system, which can then travel throughout the circulation system and end up in the lungs. That can lead to difficulty breathing. It can be life-threatening or fatal. There have been some fatalities in other locations, and particularly in other countries as well. And so we want to talk about what is the recommendation to make this a safer procedure. A few months ago, the American Society of Plastic Surgery had a task force that met to determine what's the safest way to do this. And the recommendation was that if you do fat transfer to the buttocks, the place that you should put that is in the space between the skin and the muscles, or the gluteus muscles of the buttocks. There's a natural fat layer there, and that has small and less plentiful blood vessels, so it's a safer zone to inject fat into. On the other hand, for years some surgeons have felt that they can get more fat and more volume by also injecting into the muscle of the buttocks. Doing so, it poses a particular risk because there are larger blood vessels in the muscles, and so it is not recommended to inject any fat within the muscles itself. So hopefully that video shows the difference between injecting in that space between the skin and the muscle, and then injecting into the muscle itself. In our practice, we have always, even before the recommendation, injected into the space between the skin and the muscle, and had very, very safe outcomes without any problems doing it that way. Hopefully that provides some information on this procedure, which is very popular.